Hi, Dr. Rutherford here, and today we're going to be talking about the best diet for fibromyalgia. I almost said Hashimoto's, but they're close. As most of you have fibromyalgia know, many of you have Hashimoto's. And the best diet for fibromyalgia there is none. There is not one particular best diet for fibromyalgia. It's the never-ending search for the one silver bullet. And I think if we've learned one thing in our practice over the last, particularly the last, I would say 3.5 years, is there's no one diet. Now let's talk about diet in general. Okay, what components go into diet? You have the paleo diet, you have the autoimmune paleo diet, you have the ketogenic diet, you have the elemental diet, you have all these different diets and they're trying to mess with different things to mess with your chemistry. But diet is really, it's really about dampening inflammation. The diet's really about handling what's there. And we've really almost never used one diet. If a person's got fibromyalgia and comes in here, I don't think we ever use one diet, just one diet. Even though the autoimmune paleo diet was put together for situations like that, I think even the lady who put that together would acknowledge that it's not the one diet for autoimmunity even. So it's a good diet to start with. So here's the deal. Person comes in with fibromyalgia, their gut's broken down. Okay, we check them out, and we find out that they got a zillion food sensitivities. Now, I'm not talking food allergies, I'm talking food sensitivities. That's diet. Oh my God, like I got like 59 food sensitivities, I'm never going to be able to eat again, which is not true. Food sensitivities can come and if you get them under control, they can go, but you have to get them under control. So how do you get them under control? Well, you get food sensitivities because your whole digestive chain is broken down. Most of you have bad stomach, most of you have a bad pancreas, a lot of you have bad gallbladders, a ton of you don't have a gallbladder, you got inflammation in your system, you got irritable bowel, and then maybe you got small intestinal bacterial overgrowth. What's the one diet for that? There is none. And this is your fibromyalgia patient. This is who walks in here. Some variation of all of that. Maybe you have ulcerative colitis, maybe you don't have ulcerative colitis, because most people have fibromyalgia come in here, have autoimmunity. They don't have just one autoimmune. They don't just have Hashimoto's. They might have Hashimoto's and celiac. That's easy. You just get them off of gluten and they feel wonderful, or better anyway. But you have ulcerative colitis diet, you had an autoimmune problem there. So now, you're on the autoimmune diet. You need to attack a case like that, diet is incredibly important. It's the baseline. If you are trying to treat somebody's chronic pain issues and they're having fluctuating blood sugar issues and that are going up and down, and maybe that's causing their muscles to hurt, and maybe it's causing their joint pains, you're not going to get that under control if you're eating foods every day that are food sensitivities that you're not even aware that broccoli is flaring you up. So that's an important part of diet for fibromyalgia patients, and frankly for any chronic condition patient. Then you have to fine tune it to what that person has. Does that person have autoimmunity? Okay, if they have autoimmunity, then certainly you want to find out what all the dietary triggers are. Well, that could be specific groups, the nightshades, the infamous nightshades, and there's actually nightshades that maybe you can eat. There's lectins, as the one gentleman has made $1 billion online having you buy his lectin book. And for some people they do it and it's a miracle, and other people it doesn't change anything. So you have to figure out what's right with that, with either an allergy elimination diet. We are now using food sensitivity tests. They're not perfect. So we've had to read the tea leaves. We've had to learn how to read the tea leaves with the findings from the food sensitivity test versus what that person's condition is. Do they have leaky gut? Do they have ulcerative colitis? Do they have gluten? Do they have small intestinal bacterial overgrowth? If you have small intestinal bacterial overgrowth and we put you on an autoimmune paleo diet, you're going to blow up and think we're an idiot. But we're not idiots, because that's one of the best ways to find out if you have small intestinal bacterial overgrowth. So for those of you who have read that the autoimmune paleo diet is the diet for fibromyalgia, and it can be for some of you, and you blow up, guess what? You probably have small intestinal bacterial overgrowth. So now what? You have small intestinal bacterial overgrowth, you have food sensitivities, you have autoimmunity. Which diet do you choose? Frankly, it's bits and pieces of all three of them. And you have to learn how to kind of figure out how to address it with that particular person. If you have 50 food sensitivities, now food sensitivities are something that will come and go. In other words, you can get rid of them. They're not like allergies. They're not like lifetime death sentence, like I can never eat this food again. In fact, frequently you can eat little teeny bits of that food and drip it in if you need to. Because if you take 59 food sensitivities away from somebody and you put them on the autoimmune paleo diet, I mean, all they got left to eat is like water and air. And so, so you have to be able to help that person to be able to eat while you're getting them through this, yet still heal their gut, yet still get rid of their food sensitivities, and yet still get rid of small intestinal bacterial overgrowth. So I'm not trying to disappoint you in a sense of saying like, look, this is hard to do. If you really don't have, you have to have a basic understanding of all that first, and then you can maneuver. Now, there's some of you, the autoimmune paleo diet is going to be the thing. You're going to get off of it. And here's been my experience. If I put somebody on an autoimmune paleo diet and they're wonderful in like 2 weeks, they probably have celiac. That's been my observation, okay? Because you've taken the gluten out and it's like a miracle. Because a lot of people will get off of gluten and they won't feel better, or they'll feel just a little bit better. It's because those people have other food sensitivities, and getting rid of just gluten isn't the miracle cure. It's a huge help. So if you get on an autoimmune paleo diet, I'm giving you now the clinical pearls to help you potentially figure this out. If you get on an autoimmune paleo diet and you blow up, you probably have small intestinal bacterial overgrowth, which is no small thing to get rid of. Because now you go on a low FODMAP diet, there's another one for you, and it doesn't work. And you're like, well, it worked for 2 weeks. What happened? Well, it's very possible that you may have gastritis. If you're a fibromyalgia or patient and you can't eat spicy foods or vinegar burns your stomach, you may have gastritis. If you have gastritis, you're not going to get rid of the SIBO unless you get rid of the gastritis, and that's another diet. So we spend the first hour that we talk to a patient, a lot of it's talking to them about diet, giving them resources for the diet, and then usually the first couple of visits is diet. Getting that diet under control can be huge. In most cases, it is huge. In most cases, we'll see noticeable changes in like 4 to 6 weeks. And we usually can figure the diet out within about a week or two. But we know what we're doing. And I am telling you, it's not easy. And I say we, it's me and another doctor who works here who does nothing but diet and study diet and treat people. And so there are glitches in diet relative to your stomach. If your stomach's not working right, if you have autoimmune gastritis, if you have ulcers, if you just have inflammatory issues in your stomach, that affects what type of a diet you're going to have. And there's more, which I'm not going to get into, because then you're probably going to start throwing rotten tomatoes at the screen or something like that. But this is the reality of diet. This was our biggest challenge over the years, was really, really working hard to figure out that there was no one diet, not being real happy about that, and then spending a couple of years figuring out everything I'm just blathering at you right now. And there's more. But what I said right now is really kind of the core. It's really the core. We use like 9 different diets. And we rarely use one. Oftentimes we will combine 2 and at times 3 different diets over a period of the first 6 weeks. We might start with 1 or 2 and then as that calms things down, change to a third one, and then boom, now we know where it is, and the person's doing well, and then a couple weeks later start reintroducing foods. And so it's complex, and I think it's it's the biggest thing I'm seeing right now. When patients come to me now from other functional medicine practitioners and their protocols have failed, there's 2 or 3 things I'm seeing that are causing that. And there's not a knock on other functional medicine practitioners. It's just the way it's taught. The way it's taught is do the paleo diet, do the autoimmune paleo diet, do the FODMAP diet. Okay, it didn't work. Now where do I go? And that's the biggest thing I'm seeing is the diet is not, the baseline is just not being established. Good luck in fixing anything else. Good luck in fixing your blood sugar if you have blood sugar problems. If you have all these things, the keto diet and intermittent fasting ain't going to do it. Okay, if you don't have all those things, it'll work. So I mean, diet's complex. It's all relative to how your gut is broken down, really. What parts of it are damaged? What type of bacterial imbalances you have there? Do you have enough hydrochloric acid in your stomach? Does your pancreas putting out enzymes? Do you have a gallbladder? Do you not have a gallbladder? All these things affect that. I mean, just that made me think of 5 more things that I could have said. So we'll leave it at that. There is back to the beginning, there is no one perfect diet for fibromyalgia, which is a huge part of why you're thrashing around trying to figure out how to get better. So that's it. No specific diet for fibromyalgia.